So the process to get into ABA and Hope Ridge specifically is a child needs to have a diagnosis of autism. ABA is covered by insurance, but only if you have an autism diagnosis.
The process is sitting down with the psychologist and interviewing the parents about their behaviors, looking at previous testing data, school data, and then we do a structured observation of the child that compares their behaviors in that setting with what we know about autism, and then confirming that the diagnosis is there if they meet enough of the criteria for autism.
If they're a young child, some of the things that you want to look for are a lack of eye contact, lack of being able to engage in pretend play. So for example, if you have a toddler and they are not interacting with baby dolls, they're not really using them to try to play, pretend to rock them or put them to bed. Oftentimes they prefer to be alone as opposed to be with other people. They don't start interacting with other kids. We call that parallel play, moving to more of an interactive play. They prefer to just continue to stay solitary.
So difficulty with socializing with other kids, repetitive behaviors such as toe walking, rocking, spinning. Those are the classic signs.
Many kids with autism spectrum disorder have these heightened sensitivities to things tactile, things auditory, things olfactory and thermal. And as a result of that, they often recoil from situations and develop an intolerance for being in certain places and in certain environments. And the reason many of these kids have food-related issues is because of sensitivities that they have from an oral standpoint. They can't tolerate various textures in their mouth. They can't tolerate the smell of food or even the taste of food, for example. So those would all be some early indicators.
Once they've been diagnosed, they get referred. To Hope Ridge and they start the patient paperwork. They'll set up an initial evaluation time with, typically it's a BCBA, who will meet with client, they'll meet with the parent or the guardian, they'll ask a bunch of questions. They'll determine if ABA is the right avenue for this client and how many hours would be appropriate. Once we have the staff available, then they come in and we get started.
I think parents are afraid of the label of autism sometimes and afraid that this is going to change the course of their child's life, and really I've had no one come back and say they wish they hadn't labeled their child autism, because in beginning to accept a diagnosis of autism starts the therapy for it, so it really opens up their world, it doesn't close it down.